overactive incontinence, health of your pelvic floor, and your legs. That's right. That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. One of the things that you need to be aware of if you have especially overactive incontinence and pelvic floor dysfunction has to do with the nerves that basically go to your bladder, which also innervate or provide nerve command communication to the muscles of your pelvic floor. One of the branches of that nerve actually go down your leg. So what they're doing these days is they are actually stimulating this nerve down here by your ankle on the leg part to address some of the overactive incontinence. So while the stimulation of that allows the patient to really support the normal communication to the bladder, and it's an indirect but related way to address those nerves, you have to also keep in mind that overactive incontinence also is very much relying on the habits that you form. It's called JICKY, just in case type of urination, where you just go to the bathroom just in case you can't hold it. You're basically training your bladder to not hold on to the urine, and so it becomes less conditioned to expand, and you're actually feeding the problem just by that habit. So make sure that you're understanding. I'm not suggesting placing muscle stim pads in these areas to address your overactive bladder and making sure that everything else is good. You still need to look into other things that feed this problem. That's quite interesting and goes to show you that the site of your problem does not necessarily have to be the site of pain or symptoms. So we can address this for issues that have to do with overactive bladder while we're addressing other factors that feed the issue, like your habits, like the positioning and alignment of your pelvis, the positioning and integrity of your hip mobility, your lower back mobility, and other things. I've written a blog on overactive incontinence, done other videos on the subject as well. I suggest that you look into it. If you have not subscribed to my channel, make sure you do so. If you have any questions, use one of the methods of contact in the description box to contact me. Until next time, take care.